Hello and welcome to Healthwatch. I'm your host, Carolyn Wilson from Light Health District. The goal of this program is to bring you information on a wide range of public health topics and to introduce you to the people doing great work across the community. Today, I'm joined by Karensa Mansfield from Light Health District. And today we're going to be talking about the Ledyard Prevention Coalition's 10 years of the Drug-Free Communities Grant. Karensa, welcome to the show.
Hi, thanks for having me.
So I get the pleasure of working with you a lot. We've been colleagues at Light for many years now. Tell us a little bit about how you got interested in public health and what brought you to Light.
Yeah, sure. So I've always liked how public health is about improving the health of the community through wellness programs, education, disease prevention efforts, providing access to health care, and responding to pandemics like we did back in 2009 with the swine flu, and then most recently with the coronavirus. I think in public health, you have the opportunity to prevent disease and to improve people's overall quality of life. And, you get to have the opportunity to advocate for health policies and laws, and you can conduct research. So being in public health, it's a very broad range of ways to help the community. And I ended up at Light because way back when I was doing my internship for the New London Health Department. At that time, New London was its own health department and Groton had its own health department. And the director of health for the New London Health Department referred me to Light because they had recently received a cardiovascular disease grant and they were looking for a program coordinator at the time I was wrapping up my internship. And, everything just fell into the right, it fell into place at the right time. So that's how I ended up here.
That's awesome. And you've been at Light for many years. You did mention what brought you to Light. Tell us about the other programs you've worked on over the years.
Oh my goodness. So many programs. So I started off with working on a cardiovascular disease program. I've worked on breast cancer awareness prevention programs, obesity prevention, tobacco cessation, underage drinking, Lyme disease prevention, and I'm probably missing a couple, but that's the majority of the ones I worked on.
Yeah, and it's great to know, and as I have as well, when you're at Light, you have the opportunity, usually depending on grants, to work on many different things, depending on what we have funding for. So every day is a little bit different.
Yes, and that's a really good point. All of these programs that I've worked on over the years have been grant funded.
Right. So I know currently you're the coordinator for the Ledyard Prevention Coalition. Tell us a little bit about how that group got started.
Sure. So it was established in 2007 as a result of a youth survey. Saw the need that we could have a little help in some underage drinking prevention. So we received a grant back then from the Department of Mental Health and Addiction Services to address underage drinking in Ledyard. And the Department of Mental Health wanted you to establish a coalition and make sure you had the community members on board to make change. So yes, it started in 2007 with a small grant from DEMIS. And since that time, we've received additional funding from a Drug-Free Communities grant. And this grant allowed us not only to address underage drinking, but to also focus on other drugs, such as prescription drugs. I'm blanking, sorry. Oh, marijuana, my bad. Marijuana and also underage drinking, with a focus on youth ages 12 to 18.
Right, and I do similar work for the town of Groton with GASP, so I know a little bit about that program. And you are a drug-free communities grant recipient, say that 10 times fast. Tell us about some of that work and what's funded by the grant.
Okay, so as I mentioned, we received our drug-free communities grant in 2015. So here we are in year 10, which is a huge accomplishment. And over those 10 years, we've done so much work in Ledyard. We have created and promoted so many prevention campaigns. Some of them you may recognize that have been in the community over the years. We created Parents Who Host Lose the Most, which is a campaign targeting parents around advertising and promoting the social host law. We've had our Take It to the Box campaign. We've worked with the police departments to do party patrols and compliance checks. We've done a parent campaign called Talk They Hear You, another one called 21 for a Reason. We've worked with the Ledyard Parks and Recreation to install signage, letting everyone know that no smoking or vaping or any sort of drug use is allowed on any of Ledyard's parks. We've offered all kinds of trainings to the community, from mental health first aid training, suicide prevention trainings, Narcan trainings, and these are all done in the community at churches, at businesses, anywhere. If we get a request, we're there and we'll train you. So a lot of education through campaigns and trainings, and so we've been busy over the past 10 years.
Yes, and I can relate to that a little bit. When I first came to Ledgelight and worked with GASP, with Michelle Hamilton and you, Groton was the recipient of a drug-free communities grant. I came in sort of at the end of that, but I can attest to what a competitive grant that is. It's not easy to get. You really have to prove yourself as a coalition. So that alone, when a community gets that, it really sets you apart. And it's a lot of work, but the nice thing is you really get to build that sustainability, all these great things that you can do, and hopefully the town will continue that work, beyond the funding, or more funding is secured. So drug-free communities is a great program. I know in prevention, obviously you mentioned the focus is ages 12 to 18. Youth typically is always a focus in prevention, along with people's families as well. Tell us about some of the youth-centered activities that you've implemented over the years.
Sure. So fortunately, we have a great youth coordinator, Carl Jennings, who has really been instrumental in recruiting teens to create some of our youth-focused campaigns. So for example, one campaign that they created was a PSA around driving while high on marijuana. And the name of this campaign was called Don't Be Bugging, Driving and Drugging. We also came up with a campaign called Have a Ball Without Alcohol. Carl and some of the teens have created videos around vaping prevention. They had a video called Vape Busters, the Power of Prevention, Don't Vape, Don't Self-Hate. Some other things that we've done with the youth is we've worked closely with our Ledyard's Lions Club, and we support their yearly poster contest that they have. And one year we also worked with them to provide a scholarship to the most improved student at the Ledyard High School. Some other things that we do, we offer a leadership program once a year. We work with the guidance counselors at the middle school to determine kids who would be good leaders if given the opportunity, and we do a one-day retreat with them. We work with Ledyard Parks and Recreation to offer a class or a little program during their overall summer program about prevention skills. And we've also worked with Mashantucket Pequot Tribal Nation, their High Five program. So we've collaborated with them. We've really done a lot, with our youth. We've also done sticker shocks, which is really fun, where you go into alcohol establishments and you post stickers on everything saying, it's 21 is the drinking age, just to remind people in case they think they're going to be buying for someone underage. And so we remind them.
Yes, that seems like you've done so much work, and the kids are engaged and they're getting education and awareness, and they're busy. So that's great. Mm-hmm. So when we talk about prevention coalitions as a whole, we know that ideally, in a perfect world, we would have all 12 sectors of the community represented. And this is not a pop quiz about what all the sectors are, because sometimes I can't even name them. Tell us about some of the sector members, some of the agencies who make Ledyard Prevention Coalition so successful.
So yeah, actually, as one requirement to obtain a drug-free communities grant is to have those 12 sectors represented. And fortunately, our sector members are just so supportive. They're very engaged. We wouldn't have been able to have the grant for 10 years if it wasn't for them. And actually, I'd really like to take a moment just to give all, my member sectors a quick shout out, because, it's really because of them that we're able to do the work that we do. So from our government sector, we have Mayor Allen and Council Chairwoman Naomi Rodriguez. We have our school principals, Ryan Early and Amanda Fagan. Our civic sector, we have the Lions Club, Laura Rowe, who is just fantastic. Our law enforcement, they help us tremendously. They've just been such a great partner. Chief Rich and his staff. Our business sector, we have Valentino's owner, Jackie Varley. At Ledyard Parks and Recreation, we have Scott Johnson and Jen Smith from the Ledyard Public Library. Representing our media sector, we have Tim Burrows at WBMW. And also for our faith sector, we have Reverend Heidi Johnson from St. Luke's Lutheran Church. And our tribal government representation, we have Malaysia Thomas from Mashantucket Pequot Tribal Nation, and we also have several parents and students that have been involved over the years. But those are really kind of our core members who are just awesome. So bravo to them.
Yeah, and I can attest that, sometimes, people are busy and they don't always have time for everything. And sometimes the people that we're really looking for to serve on coalitions have a lot of different demands on their time, and we really appreciate when they dedicate themselves to the work that we do, because it makes all the difference.
Mm-hmm.
Yeah.
Absolutely.
Yeah. So we're going to take a little of a quick break. We're going to come back and have more Health Watch with Karensa Mansfield.
I'm an ex-drug dealer, and I'll be your sub today. Two milligrams of fentanyl can be lethal. A lethal dose is in here. Who gets it, I won't know.
It's cheap, it's potent, and it's profitable.
The sad reality is, fentanyl is being mixed into everything now.
More kids should know.
Substance use disorder and addiction is so isolating. And so, as a Black woman in recovery, hope must be loud. It grows louder when you ask for help, and you're vulnerable. It is the thread that lets you know that no matter what happens, you will be okay.
Welcome back to Healthwatch. Today I'm joined by Karensa Mansfield from Ledyard Health District, and today we've been talking about the Ledyard Prevention Coalition. So Karensa, before the break, we were getting to know you a little bit and a little bit about the history of Ledyard Prevention Coalition, and of course, some of the great work you've been doing with the Drug Free Communities Grant. In prevention, one of the things we talk about is prescription drug abuse prevention, safe storage, safe disposal. Tell us a little bit about the drug take-back days that you have been doing for Ledyard Prevention Coalition, and tell us why they continue to be so important.
Sure. So one of the things that we do as every year, and we've been doing it now for probably close to 5 years, is our prescription drug take-back days. So they have 2 nationally, one in October and one in April. And this is an opportunity where we work with the police, and we let the community know that there's a take-back day, and we encourage them to bring all and any unused prescription drugs to the drop box, no question asked. We basically have we have it set up as like a nice drive-through. So it's very convenient for people to grab their unused prescription drugs and come to the take back day and dispose of their drugs. So we do this twice a year. Like I said, it's a national thing. So several other police stations and coalitions are doing this across the country. I know GASP in Groton has one. I think maybe Stonington does. There's several other local towns that participate in these 2 days. And these 2 take-back days are extremely successful. And we average between 60 and 70 pounds of unused prescription drugs every time we do this. So that's a lot of drugs to get off the, possibly off the streets or get into the hands of someone who doesn't need them. So it's a great program that we do. And in addition to participating in the two days, we also have a couple prescription take-back days at the Ledyard Senior Center, where we'll coordinate the police officer to come over, and we'll hang out with the seniors for the day and encourage them to bring their prescription drugs, more for just convenience, for them, so they don't have to go out just on, the days we have it. And it's just, nice to hang with the seniors and collect their prescription drugs.
Yes,
So,
it's a great program.
yeah,
Yes,
it
so-
is really.
So I know that in Groton, we also have that program. And I remember when we were just starting to get the boxes and have them installed. I think it was maybe 2012, I think in Groton we started, maybe 2013. But I know that it didn't take long for us to reach a ton, 2 tons of prescription drugs over the time, because it was such a popular program. And I know that a lot of people know about the boxes and how you can bring them to the police station. Some people don't know that you can do it any time of day. You don't have to have an appointment. You don't have to talk to anybody. And you can trust that they'll be discarded the proper way. So great program in Ledyard. And I hope that everybody, no matter where you live, uses the program in their town, because it's the best way to do that. So I know that another thing that Ledyard has been working on is collaborating with the NLC Cares program at Ledyard that focuses more on harm reduction, and doing so with the opioid settlement funds. Tell us about some of the opportunities Ledyard residents can participate in through that program.
Sure. So we've contracted with the town of Ledyard to utilize some of their opioid settlement funds to go out in the community and provide like a recovery wellness program, opioid prevention recovery and wellness program. And part of this program, we do Narcan trainings, or I should actually say naloxone. Narcan is the brand name. And so we've been going into the community and doing these trainings to, we've done them for the school staff, businesses. We just did one the other day at a physical therapy business. We've done trainings at municipal offices, civic groups, school faculty. And at these trainings, we also distribute Narcan. And I really just kind of am the coordinator to make this happen. But it's really great to have a couple of our navigators provide the program. So we usually have 2 navigators that come, and they'll talk about, it's not just a Narcan training, it's more inclusive of talking about stigma around opioid and drug use, harm reduction, really meeting people where they're at in their drug use, and providing them with the Narcan in case something does happen. You know, they are able to save a life. And, you know, they talk a lot about, you know, don't use alone. And so they're really great to work with. It's really nice to bring them in. You know, the Ledyard Prevention Coalition is so much about prevention, and to really have this other component of with the harm reduction is just, it's really a nice comprehensive approach to opioids and drug use.
And I know that you, speaking a little bit about the youth program, you've been working with Real E-Media on some projects. Tell us about the project you're working on with them right now.
So this is strictly a vaping prevention video. We received a small grant from one of our friends at CRAC. They're an organization that we work with, and we wrote a grant, and they provide us with some funds to do vaping education. So again, we will be working with Real E-Media and our youth coordinator, Carl, and some kids at both the high school and Ledyard Middle School to create a vaping public services announcement, like a little PSA talking about the harmful effects of vaping, whether that be tobacco, marijuana, you know, whatever they're vaping, just to get that out there and create this PSA that will be, you know, posted on social media outlets and on the school TVs, and, you know, hopefully be able to reach their peers around vaping.
Great. And what would you say, since we're talking about 10 years, and obviously you've been involved for longer than that, what are some of your favorite memories over the years from the Ledyard Prevention Coalition?
I really enjoy working in the community. Some of my favorite moments or favorite times or events, compliance checks are always fun. You know, you get to go with the teen and the police officer and drive around the car and go to the different stores. Take back days are always great. We've done some prevention pep rallies in the past at the high school and the middle school, and those have been really fun. Our leadership program's great, and just a lot of good memories for sure.
Awesome. And the last part of today, we can talk about, how is this work rewarding to you? What do you take away at the end of the day?
Well, all of it, you know, I enjoy all of it. As, you know, I mentioned all the fun things that we do, but, and prevention's tough because, things move very slowly in prevention. You don't have that immediate gratification that we're all used to today, with phones and, just how everything is so instantaneous. So you kind of have to be patient for sure when you're in this work, and just kind of remember you're a small part of a bigger picture, which kind of keeps me motivated, because you're not going to see immediate results. So I think that's kind of what I enjoy about it and take away from it the most.
Awesome. Well, Karensa, it's been such a joy talking with you today. You and I know, get to work together, and we can relate to the work that we do in Ledyard and Groton. Sometimes I feel like we're sister communities, and in the past we've been able to collaborate, and there's a lot of similarities to the work that we do. So 10 years of drug-free communities, it's a huge deal. Congratulations. And again, thank you so much for joining us today.
Sure, thanks for having me.
Thank you so much for joining us today on Health Watch. We hope you enjoyed it, and we hope you'll join us again soon, right here on Health Watch.